It's good, we got people here. Great.
That's always a plus.
And with the recording. I don't know if for the maybe Maria will show up today. Because I did. I was here. Good morning, everyone. How's everyone doing today? Good. Yeah, it's great. Happy Halloween. What an exciting day it is. Don't eat too much candy today. I know. We have two. So for those of you who don't know me, I'm Michelle Harrington, and I'm the benefits manager here for the City of Manchester. I have the pleasure of introducing Karen Hoffman from HSA Bank. She is here today to talk to you about everything health savings account. HSA Bank is our carrier for flexible spending, but we're not going to be talking about that today. It's just health savings accounts. So I'll just let her have the floor. If you have any questions, that would be great for you to ask her. Just FYI, this is being recorded so we can share it with other employees. So I just want to let you know that you'll be on the record. So take it away, Karen.
Thanks so much, Michelle. So if anyone has personal questions, just come to me afterwards and, we can talk about it and, answer your questions so it's not on the record. So first of all, hi, everybody. Thanks for showing up today. I'm here to talk about the HSA, and one of the things about the HSA, remember, is while it's tied to your medical insurance, it is a bank account. It's a bank account that you own, and there's over 30 million HSAs in the United States today. And one of the reasons that they're becoming so popular is it's a way for people to put aside money and have some peace of mind. It's actually, I like to have people think about an HSA less as a spending account and more as a savings or retirement account. So it's kind of a way to flip the script and get you to start thinking as another bucket for retirement. So I do want to touch a little bit upon, FSA versus HSA, because there are some differences. First of all, who owns, the ownership of it? That is different. With an FSA, that's an employer benefit. So the employer is the one who dictates it and owns it, essentially. You don't own it. With an HSA, you own that account. It doesn't matter if you ever were to leave, or if you were to retire, or if you were to change bank or medical plans, that HSA account remains yours. So the ownership is a big deal. Another thing is what you can use it on. Well, there's no differences, all right? So there's no differences between an FSA and an HSA as to what you can use the expenses on. It's all dictated by the IRS. So it's eligible medical expenses. That's what you can use either the FSA or the HSA on. But there is a little difference after you turn age 65. Because after you turn age 65, you can actually use the money in your HSA for non-medical eligible benefits. And we're going to talk a little bit about that. Use it or lose it. So that's one of the things that sometimes people get mixed up. They think, oh, I'm in an HSA, I have to use it or I'm going to lose it. That's not true. All right, that is with the flexible spending account. With a flexible spending account, yeah, you have until the end of your plan year, and then if you have more than what the carryover is, because they do allow a little bit of a carryover, like $610, $640, depending on what the provision is, you can carry that over. But anything above that, if you didn't use it, yeah, you would lose it. With an HSA, not the case. If you get to the end of your year, guess what? You still have that money the next year. It continues to grow and compound just like it would if you were putting money in, say, another banking account. So that's a really positive aspect of it. Another thing is, when are the funds available? So there is a difference too. When you're in a flexible spending account, one of the benefits is whatever you elect is available on the first day of your plan year. So you guys have a 7-1 plan year. It would be available, if you put in $3,000, elected to have that deducted from your pay, that would be available on July 1st. And that's really cool. HSA, not the same. It's just like a regular bank account. It's only in there as you deposit the money or as your employer deposits the money for you. So that's the one thing that you have to consider. But I'm going to talk to you about how you can allay certain concerns, because sometimes people do get concerned about, well, I just got in it. What happens if I have something that happens, right after? What do I do? We're going to talk a little bit about that and some strategies. Next, contributions. Like I said, what are the contributions? It's still tax advantaged regardless of which account that you're in. So it's going to come out of your paycheck and it's going to come out tax-free in either one. And when you use it for qualified medical expenses, again, tax-free. So that's going to be the same. But again, one of the other biggest ones where I was talking about, the whole retirement aspect of it. With an FSA, you don't have that ability. With the HSA, not only can you grow that account, let it roll over, but you can actually do investments with your HSA and have it grow that much more. Can't do that with an FSA. So before I move on, any questions? Okay. All right, we talk about the HSA in terms of a safety net. And one of the reasons that we say that is because when we look at HealthView Services study and other studies, there's a lot of Americans who don't put aside any money for their health care. In fact, 40% of Americans never save for their health care expenses, and 30% never even shop around for their medical costs or consider medical costs before they purchase it. And one of the things that you can do with that HSA is, this is where it makes a change, and you can shop for and you can do this, and we encourage you to do that. So what exactly is an HSA? Most of you probably already know. Like, we call it an HSA, but it's a health savings account. Again, savings. And in that, where you can be able to put money again, pre-tax, but again, we also want you to consider this as a retirement account, because again, you have that ability to put that money aside and not only just let it grow, you can also, use it for investments and have it grow that much more. So we kind of like people to think about it as, HSA is like a 401k, but for your health care. So how it works. First of all, you have to be enrolled in a qualified high deductible health plan. And who determines what's a qualified high deductible health plan? The IRS. And from year to year, it may have an increased deductible depending on what it is. You guys, if you're here, chances are you're enrolled in that qualified high deductible plan. That's the main component that you have to have. Another thing is you use it for qualified medical expenses. So again, with a high deductible plan that your health plan is going to cover certain services. It's going to cover your preventive services no matter where you are within your deductible. So if you go for your annual physical, if you go for an annual pap smear, mammogram, routine colonoscopy, all of those things are covered in full thanks to your medical plan. So you don't have to worry about paying for that. But anything else, guess what? That's on you. All right, so anytime if you go to the doctor's office because you have, the flu, if you have to go get stitches, if you have to go pick up a prescription, that's going to be on you. So how do you pay for that, until you hit your deductible? That's where the HSA comes in, and that's where you put the money aside and you're able to use that. All right, but you can also use it after the deductible's been met as well, because after the deductible, you may still have costs. Well, you can still continue to use your HSA for those as well. There are also some criteria as to who can open and contribute to an HSA. So as I mentioned before, the first criteria, got to be enrolled in that high deductible health plan. You also have to have a active social security number, and your primary residence has to be in the United States. And then there's a few things that would preclude you or make you not be able to contribute to your HSA. One of which is you cannot be enrolled in any other type of health plan, including Medicare's Parts A, B, C, D, E, F, G. No, you can't be enrolled in any of those. But here's another thing. So if you have a spouse who is enrolled in a medical plan elsewhere, and let's say they're covering the kids, so they've got a family coverage, so they're throwing on you as well, right? Guess what? That would make you ineligible to contribute to your HSA because you would be covered under another medical plan. All right? So oftentimes, this is actually a good time of year to have those kitchen table conversations and to make sure that if your spouse is enrolling in another plan, because this is also open enrollment plan time for a lot of other employers, make sure that they are not including you on their PPO plan. Another thing is you cannot be covered under TRICARE, which is the government's health care. So if you're in that, you can't contribute to an HSA. You can't be covered by Indian Health Services, and you cannot have received medical benefits from the VA for any non-service connected disability within the previous 3 months. Now, does this mean that you can't ever contribute to your HSA? No. It just means that if you've had that, then you have to wait the 3 months, and then you can start contributing again. And if you ever do have questions, you can always reach out and call our 800 number. They will help you out and tell you what to do. All right? You cannot be claimed as a dependent on another person's tax return, with the exception of your spouse. So where does this fall into place? It falls in for, younger folks who are still living at home and, under the age of 24. You may be working, you may be, doing whatever. But if your parent still claims you as a dependent, then you cannot contribute to your HSA. All right? And then finally, here's the big one. And it doesn't really affect folks here per se, but you cannot be enrolled in a full medical flexible spending account. So if you are enrolled in one of those, then you cannot contribute to your HSA. Now, your employer is not going to allow you to enroll in both, all right? And not to mention, we have your benefits, so we're going to know if you're enrolling in both. Again, here's with that spousal conversation that you need to have. So if your spouse works somewhere else and they're under a PPO plan and they want to do a flexible spending account, sounds like a great idea. But if they enroll in that flexible spending account, it actually covers you as well, because they can use their FSA dollars for your expenses even if you're not on their medical plan. And that would mean that you're covered under actually another medical plan. And again, it would prohibit you from being able to contribute to your HSA. So make sure that your spouse is also not in a flexible spending account, all right? They can do a limited purpose flexible spending account, which is one where they can just cover vision and dental, but they can't be in the full one. Right? And remember, you can use your HSA to cover their expenses. Even if they're not covered under your medical plan, doesn't matter. You can still use your HSA to cover that. So that's where you can take care of that. Any questions before we move on? Michelle?
Does it have to be your tax dependent?
Yes. Yes, it does have to be your tax dependent. Yes. There was another question?
I was just going to ask.
Gotcha. So we talked a little bit about Medicare, so I just want to touch upon this again. So if you are in any part of Medicare, again, you cannot contribute to your HSA. So as soon as you do that, the month that you're going to have turned 65, or if that's when you're doing it, you have to stop your contributions. But do you lose your HSA? No. You can continue to have it and spend it down. You just can't get any contributions. And that includes both employer and employee. But there's a lot of people who may decide that they're going to delay Medicare. Maybe you're working later. Maybe you're working until age 67 or age 70. If you do that, you can continue to contribute to your HSA as long as you have delayed both parts of Medicare, both parts A and B. Because one you get automatically, and one you have to elect and enroll in, all right? But you have to make sure that you delay both, all right? So talk to Medicare about that. Now here's the other thing. If you have done that, then you will need to stop your deductions to your HSA 6 months prior to enrolling in that delayed Medicare. Why? It's because Medicare will retro your benefits 6 months. So just as a quick example, you're waiting to age 67. At age 66 and a half, that's when you need to stop your HSA contributions because, again, they're going to retro back, right? If you ever have questions, again, call, all right? Make sure that you get the information. So How do you put money into your HSA? How do you save in your HSA? Well, first of all, remember it comes out of your paycheck and it comes out pre-tax. And the IRS is the one who sets the limits for the HSA every year. And by the way, the limits change as of the calendar year. So you guys have a plan year of 7/1, but the HSA contributions adjust as of the calendar year. In 2024, the limits were $4,150 if you took individual medical coverage, and they were $8,300 if you took family medical coverage. All right. As of January 1st, it goes up. It's going to go to $4,300 for individual and $8,550 for family. So you can make that adjustment when it comes as of January, and you can up your contribution. So that's actually a really nice thing. You don't have to wait until your plan year to do so. You can do it as of January and take advantage of the extra dollars that you can put in there. Now, there's a benefit to being a little bit older. So if you are 55 years or older, you can make what's called a catch-up contribution. And that is a contribution of an extra $1,000 that you can put into your account. And that helps you to be able to save even more, especially if you're getting closer to retirement. You want to put as much money in there so that you have that bigger bucket of money once you retire. So you can do that. Now, here's the other thing. Let's say you have family coverage and you're covering your spouse, right? And your spouse is also age 55. They can also do a $1,000 catch-up contribution, but they can't put it into your HSA. You know why? Because HSAs are individually owned bank accounts. So while you can use your HSA for your tax dependent and that spouse, it's owned by you. It's ruled by your Social Security number. What the spouse can do is they can actually open up their own HSA, whether it be a HSA bank or whatever other bank, and put that $1,000 in and just bank it, or they can use it. But that way, not only can you do the extra, so for 2025, the $9,550 for you, you can do like $10,550. So if you're in that position where you're really trying to bank money away, this is a great opportunity to be able to do that extra one. Okay? Questions so far? No? All right. So strategies to save in your HSA. Remember, make sure that you're not just taking the employer's money, that you are putting in contributions of your own. So it comes out of each paycheck, and again, like I said, it comes out pre-tax. And remember, you can change the contributions. You don't have to wait for a qualifying event. You don't have to wait for open enrollment. You can make changes as you want. So you can reach out to, human resources, payroll, whatever, and be able to, make those changes. But take advantage of putting your own money in. And you can also do things like a one-time contribution. Let's say you just won the lottery. Yay! All right, well, if you want to, you can make a one-time contribution into your HSA. And maybe it's coming from your outside bank account. It's not coming from payroll. Can you do that? Absolutely. You can either do it with a form, or if you've linked a bank account on our member website, you can put a contribution in there. Now you're asking, well, where's the tax benefit to that? There is a tax benefit. You're going to get the tax documents at the end of the year that shows you put that contribution in and it didn't come out of payroll, and you're going to take that on your taxes. You'll get a tax benefit on your taxes when you actually do it. So you can do that one-time contribution when you want to. But again, everything goes up to that annual limit, whether it's employer money, your money, whether you're doing, if you got a contribution from, any outside, it all goes up to that annual maximum. You can't go over that. We always mentioned, premium savings, and also yours forever. Because again, remember, this is your bank account. You never lose it. There is no drawback of putting money into your bank account. So you're never going to lose it. Another thing too is, by the way, if you do have, you work somewhere else and maybe you have an HSA with a prior, employer and whatnot, you always can be able to, transfer that to this one, do a direct rollover transfer so that you're only managing one account, and that way you're not having fees associated with that other one. And the other thing that you can do is you can do a once per lifetime IRA transfer to your HSA as well. up to the annual limit. So again, it's all about that annual limit. But if you have an IRA and maybe you're just starting out with your HSA and you don't have a whole lot of money in there, you can do a once per lifetime. Can't do it more than that. But that's another way that you can put money into your HSA. Okay? Questions? Yes.
Is there a minimum contribution that you would have to make from your own personal account to get the tax benefit, or is it, say, if I contributed $10, I'd still
Yeah.
get that form to take home my 10%?
Yep.
So it doesn't matter. There's no.
Nope. Yep. Great question. Great question. So the HSA is what we call is a triple tax advantaged account, and actually it's one of the most tax advantaged accounts that you can find. It is one of those that's even better than the 401k, and I'm going to show you that in a little bit as well. So one of the things is, remember, you don't pay federal taxes on your contributions to your HSA, and also you don't pay state and FICA as long as you're not in New Jersey and California. Those two actually do have taxes on their states. But so you save on that taxes. So quick and easy. Let's say you're in a 24% tax rate. If you're putting in $10, it doesn't feel like $10. It only feels like $7. So there's that tax benefit. Remember that any earnings to your HSA, whether it's from interest or in investments, are going to grow tax-free because this is an interest-bearing account. It's not much of interest. It's like 0.05, but it does have interest, and that grows tax-free. And any money that you're putting into investments, those are also going to grow tax-free as well. So that's a real good benefit. And another is, remember, you don't pay taxes on distributions as long as you use it for those qualified medical expenses. It doesn't matter whether you're paying for those now or after age 65. As long as it's for a qualified medical expense, it still comes out tax-free. And that is a triple tax advantage that no other account has. We try to make it really easy to actually use and pay your HSA. First of all, you're going to get that debit card, right? And with that debit card, you can use it at the point of service. You can use it at the doctor's office. You can use it at the pharmacy. You can use it at, vision, dental, etc. Use it right there at the point of service. Now, it is tied to what they call IIAS technology. And that means that if you try to go to a liquor store, it's not going to work because that is not one of the places that you can use it. We may argue that that wine is medically necessary, but it's not. They disagree.
What if you're buying Dr. McGillicuddy's?
I'm sorry, what was the question?
What if you're buying Dr. McGillicuddy's?
I think that we should try that. We'll go to the IRS and ask about it, but I think they're going to cut us down. I'm just saying. So yes, you can use your debit card for the merchants that it actually works for. The other thing that you can do is maybe you had a hospitalization or something where you didn't have to pay right at the point of service. They had to, do all the insurance kind of things. See where you're at towards your deductible. They're going to send you a bill. Great. They send you that bill. You can actually pay it right from the online, from the member website. Put in the provider, their information, who is it for, the amount, blah, blah, blah. Send it right to them. Save the cost of a stamp. You don't have to send it to them. You don't have to call them with your number. So that's a way that you can do it. The other thing that you can do is, let's say you went somewhere and you paid out of your own pocket. All right? You can reimburse yourself for anything that you've paid out of pocket. A really good thing that you can do is, maybe you've got points on your credit card and you're trying to, JetBlue it and go somewhere. Pay for it out of your pocket, but then reimburse yourself so you can pay that credit card. So then you're going to get the points on your credit card and you're going to reimburse yourself right out of your HSA. And it keeps coming out tax-free. So like if you're on a payment plan, hey, you can do that and be able to have that available. But I'm also going to tell you this other thing is try, if you can, not to reimburse yourself right away. Why? Because you can reimburse yourself at any point in the future after you've opened up that HSA. So you can pay yourself back, now, this week. You can pay yourself back in, a month or so. You can pay yourself back in a year, 5 years, 10 years, 20 years, doesn't matter. There's a place on the member website where if you've uploaded the expense, all right, and you're going to reimburse yourself, again, it's going to ask you to fill out all that information. And then on the bottom, it's going to ask you if you want to reimburse yourself now or save for later. Imagine if you save for later, save for later, save for later. Later comes, and I need snow tires because, you know, you're here in New Hampshire, right? You can pay yourself back for any of those things that you saved for later, and it's all going to come to you tax-free, right? Question? Oh, awesome. Awesome. So, again, you know, this is a way where, you know, we give you the ability to be able to put it right into the system and keep track for you. It's kind of like a digital shoebox. It's under manage expenses, and that's where you can do that. But, you know, even if you haven't, like I always say, do as I say, not as I do. I oftentimes just take my receipt and put on there used HSA or didn't use HSA and throw it in my tax file. If I ever need to, I can just take, you know, whatever I didn't have and reimburse myself. Now, does HSA Bank require substantiation or those claims? No, we don't. Why? Because we're a bank and we don't care. Do you know who cares? The IRS. That's why it's really, really important to save those receipts, because if you were ever to be audited, right, and they say you need to provide proof that this was an eligible expense, make sure that you have it either online where you can just quickly pull it up, or, you know, if you have the physical copies. But just make sure. But we are not going to ask you. You can actually reimburse yourself out of your HSA with nothing. Just say, I just need, you know, this is what I was doing. We don't ask for proof, because this is a bank account and it is up to you. All right? Questions? Awesome. So I talk a lot about qualified medical expenses. And again, the IRS is the be-all, end-all of who determines what is a qualified medical expense. If you ever want to see, you know, the full exhaustive list, you can go to IRS Publication 502. Have fun with that, because that's a lot of fun. But otherwise, we do have the list that is online at hsabank.com, and it includes a lot of the things that you would think about. It's, you know, doctor's visits, it's pharmacy costs, it's lab visits, it's x-rays, but it's also things that you may not have thought about. It's things such as, I got sunscreen at, you know, Walgreens. It can be, I've got Visine solution. It can be feminine hygiene products. Those are actually even a qualified medical expense now. So if you ever do have questions, you can look. And here's the other cool thing that you can do. If you have the mobile app on your phone, it has a scanner, and you can actually scan and see if that is an eligible medical expense. Also, typically you're going to have on, say, your, you know, drugstore type of places, it's going to list it on there, whether it's FSA or HSA, right next to the thing on there, so you can do that. By the way, if you ever are purchasing something at, say, you know, Walgreens, and you're getting a couple of, like, Band-Aids, you know, Visine, etc., medically eligible, and then you're also getting a Snickers bar, all right, make sure that you still divide those things, all right, and like I said, you can use your debit card, but, you know, don't pay for the Snickers, you know, because that would not be a eligible item, all right? So we try to encourage people to be as conservative with your HSA in your working years as possible, because we all know that one day the goal is we want to retire. And when we retire, chances are we're going to have more expenses, right? So if you're able to build that bigger bucket of money that you can use for, you know, medical expenses later on and have that separate, that's going to benefit you. So a couple of things. Make sure that you keep up with your preventive health care appointments that are covered 100% by your health plan, because that's going to help you to, you know, hopefully, you know, stay away from the things that might actually hurt you. It's going to, you know, those preventive things are good. Shop around for the best cost, because guess what? Those costs can be different from doctor to doctor, from location to location. So make sure that you're shopping around, because this money is yours. It's not the insurance company's, it is yours. So that's a really good and important thing.
Can I just interject?
Of course.
Just I want to piggyback off of that. So we have the Smart Shopper program. How many of you have used Smart Shopper? Awesome. So if you use Smart Shopper, one, you're saving money, right, because you're going to a lower cost provider. Two, you're getting that check. It's money that you weren't really planning on, right? It's a great place to put that Smart Shopper money. So The Smart Shopper program will help you save and put extra money into your HSA account. So, just wanted to piggyback that.
Thank you very much. Another thing is, make sure that you're getting estimates before. Oh, question.
Quick question. I'm assuming if you take that Smart Shopper money and then put it in, you can get that same tax form that you were talking about.
deposit.
Oh, okay.
It's a check. Yeah, they would get a check.
Okay. And if they want to put it into their HSA, yeah.
Yeah, it would be
Yep.
just like if they transfer from one
Yep.
to another. Yeah.
Yep. So make sure that you get estimates before committing to a medical visit or procedure because, again, you want to know before you go how much money is it going to be. If it's more than what you currently have in your HSA, you can bulk it up, like plan for it, put that money there, and then once you've had it, you can back down. But to know how much that it is going to be important so that you can plan and put that money in there and have it ready. Make sure that if possible, if you have either in-network and out-of-network providers, use the in-network because again that's going to save you money and make your money last longer, and use the Decision Healthcare kind of support tools that are available. I'm sure that your health plan has tools. Michelle just mentioned a tool that's available. We also have healthcare tools that are on the website, a lot of different ones. We have ones where you can be able to do calculators and be able to figure out different type of things that are relevant to you. So there's the website that are on there. And then, as I mentioned before, try not to nickel and dime your HSA while you're in your working years. So here's one of the things that I try to do. And whether it works for you or not, if I have an expense that's under $50, I pay for it out of my own pocket. I keep that receipt. I make sure I log it because then if I ever need to pay myself back, I have it. But as long as it doesn't affect my daily living expenses, I'm going to pay for it out of my own pocket because that's going to let my HSA dollars grow more and save it for the larger expenses. All right? So try not to nickel and dime your HSA. Again, we're trying to get people to think about your HSA not just as a spending account, but as another retirement account. And if you have that mindset, it's going to last you longer and it's going to help you to grow it. So most people actually do believe that they're going to work longer than they actually can. They have this idea that, yep, I'm going to work longer. I can put more money in it. But you need to be able to make sure that you're living that. It's actually estimated that a 65-year-old couple retiring today will spend hundreds of thousands of dollars on healthcare costs in retirement. That's a scary figure. And that's everything. That's Medicare premiums. It's, anytime you have a copay, it's deductibles, it's vision, dental, etc. But over the course of your retirement lifetime, that's a lot of money. And think about this. If you don't have the HSA, how are you going to pay for it? You would use your Social Security, your 401k or 403b, or your IRA. Well, if you have that HSA, it's that separate bucket of money that's going to let that money stay for your actual living expenses, your mortgage, your car, your groceries, the different things that we need. And things get more and more expensive. So if you have that separate bucket of money, it's going to let those be for your living expenses and the other expenses that you want to have and make it last longer. And if you're using a 401k or a 403b for healthcare costs and retirement, it actually increases your tax burden. And I'm going to show you how. So here's just a study from HealthView Services. Let's just say that by the time you retire, you have $100,000 in your 401k, 403b, and another $100,000 that you've saved in your HSA. Now, both would have been with pre-tax contributions, and both would have grown tax-free, right? But let's just say, and if you're using it, for the sake of argument, that you're in the 24% tax bracket. If you use your 401k for healthcare expenses, you would pay taxes on that money, all right? It would be, if you had $100,000 and using it for health care, you would only have $76,000 at the end because they would tax it. But with that HSA, with that same $100,000, you'd be able to use the entire amount as long as it's for health care. So that way it makes your money last longer. All right. Again, a little bit more. Try to contribute up to the maximum if you're able to. If not, contribute to at least where you feel comfortable, to the deductible, and even a little bit more. Try not to use the HSA when you can pay out of your own pocket. Make sure you're doing the contributions. Take advantage of the incentives or the money that your employer is putting into that HSA for you, because you guys have a very nice benefit where your employer puts quite a bit of money in there. So take advantage of that. And then, again, treat your HSA like a retirement account. So one of the things that's kind of cool that people don't actually know is that you can use your HSA for expenses after age 65 without a penalty for non-medical related expenses. It would just be subject to normal income tax. So you're after age 65 and you want to pay yourself back, or if you want to not pay yourself back, but just withdraw the money, you can do that and use it for anything. But it's going to be subject to normal income taxes. And by the way, no, you can't use your debit card to go and get that boat, because that would not be one of those inventory places that they would actually approve it. You would have to take the money out, and at the end of the year, you're going to get the tax documents, and that's where you would have, the taxable. Now, remember, before age 65, if you use it for a non-eligible expense, it would be subject to a 20% penalty plus income tax, so don't do it. Again, who's going to find out? The IRS. So that's where you always have to plan for and make sure that you keep all of your documentation. And another way to boost retirement savings is investment options. So we're going to talk about that in just a moment. And like the 401k, that HSA helps you keep more of your money when you retire. So let's talk a little bit about the investment options. So as of September 24th, we did have a change, and the new investment options are called HSA Invest. I want to talk a little bit about the folks who may have already been either in the Schwab or the Devenir. All right, so those are going to be sunsetting. The reason that we made this change was because we wanted to have a more cohesive and have everything on our own member website. The feedback that we got from our members was that it was bulky, it was a bit confusing. You had to SSO out to either Devenir or Schwab, set up accounts there, and the money, it was slow to come back and forth. So we made that decision after a lot of thought to have our own and have it on our own website. Now, if you're either in Devenir or Schwab, after September 24th, you can no longer put any new money over into either of those accounts. Any money that's still in the investments over there, it's fine, it's going to stay there for now. As of the first quarter in 2025, Devenir is going to sunset. So any money that's left in your Devenir account, if you haven't already liquidated it yourself, it will be liquidated for you, and it would go over to your HSA cash account. All right. Schwab, it's going to have a little bit of a longer runway. We have not set up a date yet for that to sunset. So what that means is if you have money in Schwab, it can sit there, it can just do its thing over there, can't add any more new money to it, but it's not going to be liquidated. We don't have a date yet, but at some point in the future, chances are it will happen. We just haven't set that date as of now. All right. So the new options are called HSA Invest. And there are 3 options that you can do. And by the way, you can enroll in HSA Invest even if you're in Devenir and Schwab. You're going to be able to see on your member website when you go to Manage Investments, it's going to show you, enroll in HSA Invest, and it's also going to show you your Schwab and Devenir, which, again, you SSO out to. The HSA Invest will be right there. The 3 different options are Choice, Select, and Managed. So Choice is our Schwab lookalike. So with this one, it's a self-directed brokerage option where you choose the funds that you want to invest in. You can search by the name of the company, or if you know what the stock sticker is or whatever, and you can be able to invest it yourself. And it's all self-directed. You decide what you want to put in there, and it's all up to you. One of the cool things is you can do fractional shares. So I opened up my Choice account, and I bought $10 of Apple just because I could. So, that's one of the nice things. So if you're somebody who is, comfortable with the stock markets, Choice would be a great program for you. The next option is Select. So Select is like our Devenir. So this is our new Devenir. And this one has the mutual funds. So it's got a bunch of mutual fund families. I think there's currently like 28 of those. And so when you elect that one, you would be asked to take a risk tolerance questionnaire. And with that, it's going to be able to guide you from what your answers are as to what your risk tolerance is and what your objectives are. And it's going to suggest the various mutual funds that would fit what your objectives are. You have the final decision, though. You can say, yeah, thanks, but I'm going to choose this one anyway. And so that's entirely up to you. So with the Select, it's kind of like where you're choosing, somebody is looking at it for you, but you're making the ultimate decision. And again, it's in mutual funds. It's kind of similar to the 401k experience where you're in that family, all right? And it gets auto rebalanced for you, all that kind of fun stuff. The next option, it's not available quite yet. It will be available before the end of the year, is called our managed option. This is for people who are like totally, I do not want to know about this. I have no idea. Let somebody else manage my money. Great. Again, you're going to have to take that risk tolerance questionnaire, and based upon your answers, it will direct them to whatever one is good for you. You're still going to click off, yep, I agree, but then a registered investment advisor will actually do all of the work for your managed account and put it in there, rebalance it, do all those kind of fun things, and you don't have to touch it. It's kind of like the easy button or the crock pot of investments. You set it and forget it, all right? So those are the three options. So I get often asked, what about the fees? Yep. There can be fees. There were fees there were fees previously. With Schwab, there was no fees, depending on whatever that you were in. With the choice option, there will be no fees at least until 2026. All right. At that point, they are looking at fees of 10 basis points. What does that mean? It means that they have that fee. It equals to 25 cents per thousand every quarter. So, like, if you have $1,000, it's gonna take out 25 cents per quarter. And again, that won't happen until 2026, or it may even go beyond that. The Select option, Devenir had a basis points of 30. This is going to be 25, so it's going to be less. And for managed, well, because it is managed, it's going to be more. So it's going to be 35 basis points. So anytime when you elect any of these, it's going to have the transparency. You'll be able to see what any of the charges are and be able to agree to those. So just want to let you know what's up with that. So, question?
Do you know the cash equivalent of what 25, 35 points are?
I know the 25 is like 62 cents per thousand. I'm not sure what the other one is. It was in the materials, but do you think I can remember it? No, I can't remember it. But it'll have it on there, when you go to elect and enroll in it. What was that? Right, it's not quite there. It will be there soon, but it's not quite there yet. And all the disclosures are online. So like I said, you're going to see it. When you go to the Enroll in HSA Invest, you have to choose one option to enroll in first, fill out all the information, see all the disclosures, sign off, I agree, print them out, do whatever that you want, save them, yada, yada, yada. And then if you want to enroll in a second one, because like, for example, I have both the choice and the select. So I did the select one first, took the risk tolerance questionnaire, and then I went over to the select. It pre-filled out a lot of the information for me, but I still had to check off everything. So it takes a little bit of time, but it's not bad. And everything is all right there. And in fact, it's actually our easy button for like investing, because you can enroll in it at any point. So with investments, you do have to have a certain threshold before any money will go over to your investments, and that's $1,000. I actually tell people that while you can do it at $1,000, make sure that you're comfortable with your own objectives and your risk tolerance. I have mine set at $1,500. I feel comfortable within that if I need any kind of medical care, et cetera, it's going to be in my cash account. Anything above that, I can put it over to investments and, let it do what it's going to do. Because again, remember, investments are not FDIC insured like your HSA cash account is. It's going to be subject to the gains and losses of the stock market. So, sometimes you just have to put it in there and not look. Sometimes it's really good. Sometimes it's not so good. So You have to be comfortable with that. All right, but you can enroll even before you hit that threshold, so it's nice. And then you can set up whatever your preferences are, and it'll start as soon as you do hit whatever threshold that you have hit. Yes.
And then generally pulling back from investments, is there like a time lapse, like say you do have $1,500 sitting in cash, but you're investing $1,500, something comes up, you need 3,000, like how long does it take?
It doesn't take long because now everything is online. It's the same day. So if you're putting the investments in, it goes in same day. If you're taking investments out, like you need the money to pay for something, you can sell it from your investment. It goes back into your cash account, same day. And by the way, there is no taxable event from taking money from your investments and putting it into your cash account, which is really great. So again, no capital gains, no taxes, no nothing. It's all right there.
Excuse me, Karen, does that count towards contribution?
No, no, because it was already there, like something that you had. So anything that you have just kind of moves back over, transfers back over in there. Another is, again, personalized investment options. Because we have the 3, it's going to address, the different risk tolerances and objectives that people have. And remember, any of the money that is in your HSA cash balance, it's going to stay there until you actually, invest it. So that money is in your cash account for you to be able to use. And like I said, you can do a couple of different things. So you can either do a one-time transfer to your investments, whatever that you want to do, just put in, say, $500 and then not do anything else. You can do recurrent contributions. So you can say, every paycheck, I want, $50 to go, and you can break it up here, 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 and here. Or you can do what's called the threshold. And that's where you can say anything above, say, this amount, have it go over here, and you can, again, say percentage, money, whatever that you want to do, and that will go over there. So you get to set up however that you want it to go, whether it be one time, recurrent, or threshold, and set up whatever preferences that you have. And you can change it at any time. The other thing, too, is if you ever want to, you can close out these accounts. Say, like, nope, I'm good, I'm closing this, hit close, and the money will go back to your HSA Bank cash account. So, questions about the investments? Awesome. By the way, I did bring some brochures or flyers, and they are in the back of the room, especially about the investment accounts, so that you can take a look at that. If you were somebody who had the Schwab or the Devenir, you should have been getting all of our emails. We sent out emails starting at 90 days, then 60 days, then 30 days, then 15 days, and a week, and a day before, and a day after of this is what you need to do with your money. So, but if you ever have questions, call the number on the back of your debit card, and they will assist you with whatever questions. If it's something that is an investment type of thing versus like, how do I do this on the website, they will do a warm transfer over to a registered investment advisor so that you can talk to somebody about those investments. Okay, awesome. So a little bit of housekeeping. Make sure that you have designated a beneficiary for your HSA account, all right? Because this is an account just like your 401k. Heaven forbid anything ever happens to you, you want that money to go to the person that you elect. Remember, you can do both a primary and a secondary beneficiary. If you elect a spouse as your beneficiary, it will go to them as an HSA, and they can still use it tax-free. If they're enrolled in a qualified high-deductible plan, they can still make contributions to it, and they can use it, spend it down on qualified medical expenses, etc. If it goes to anyone who is not a spouse, then your HSA stops on the date of your death. It goes to them as a cash account, and it's taxable. So keep that in mind, because that would be a taxable event. Now, your beneficiaries do have 1 year from the date of your death to be able to reimburse any of the expenses that you had prior to your passing, so that you can take care of that as well, and those would come out tax-free. All right?
Where do you designate the beneficiary? Is it through the app, the HSA app, or is it through the employer?
Both. You can, well, not exactly the employer. You have to do it on the app or on the website under member, and it's under the your profile, and you can load it in there. for the employer, it's not on the website like when your HRIS system, but you can fill out a form. So you can request a form and email it in or fax it in, mail it in. But most people like to do it on the member website. And that way, remember, if you've ever had a change in circumstance, marriage, divorce, birth, death, whatever, make sure to go in just like you would do with your life insurance or your 401k, because you want to make sure whomever is going to have that money, because it could be fairly substantial, right? Any account holder changes, remember that some of these do come over from the employer, but some do not. So, if you ever have a change of name, that's the biggest one. That does not come over on any feeds, because we are a bank and we're particular. And so you have to fill out a form. Yes, you actually have to fill out a form and provide your, either marriage certificate or divorce or any other court documents that support that name change, and you do have to send that in. Also, if you're doing a change of address, you can do it online. You can actually change your address, again, under that member profile, be able to do that. And if you ever lose your debit card, guess what? It has a lot of customer service right there where you can do your own self-service, order another debit card. Maybe you want to get a debit card for one of your for your spouse or for that dependent who is 18 or over who's still on your plan. You can order a card for them under the authorized signer. So all of this is available on the member website. And again, if you have questions, call the 800 number and they will assist you. They can either order it for you or they can be able to, tell you how to do it yourself. All right? So how do you manage your account online? You can check balances. You can check whatever transactions that you had. You can order those debit cards. You can do the authorized signer. You can do the beneficiary. Everything's available online. And we've tried to make it as easy as possible. So now when you log online, you're going to have the dashboard. And you're going to be able to see right in one view what is your balance in your cash account, what's the balance in your investment account, what is your tax savings for the year. Oh, here's a cool calculator that you can use for contributions. On the left-hand side, that's where all the transactional type of stuff is. So that's where you have the menu to manage your expenses, manage your investments. You can see what your transactions were. That's where the profile is so that you can make those different preferences, etc. Everything is in there. Again, if you have questions, problems, just call and they will walk you through it. Plus, there's also a place at the top where it's a chat, so you can do some chat with them online. They won't give you detailed information per se because they can't necessarily guarantee it's you. So you may have to call, but you can do chat and figure out various things. Okay? So we do have customer service available 24/7, and you're encouraged to call them and use that. If you can, again, use the chat. There's even an email feature if you want to email as well. But they are available 24/7, so highly recommend, just giving them a call if you ever need it. But aside from that, guess what, guys? I'm done. Do you have any additional questions? Yes.
When we retire, if we take on the city healthcare, can we use our HSA to pay for that?
You can use the HSA for certain premiums. You can use it for COBRA premiums if you are have uninsurance. But for other premiums, you can't. But you can use it for Medicare premiums as well. But for that, I don't believe that would be an eligible expense. But that's a great question. Other questions? Yes.
In terms of logging expenses to be able to pay yourself back, what if, you go to the grocery store, you buy groceries, right, and you have your whole receipt, then you go to log the qualified medical expenses that come from that. When you're logging that, you have to separate what you spent on qualified medical and then just keep that entire receipt for auditing purposes.
Yeah, you know what I do? I highlight it.
Okay.
I just highlight it. I snap a picture of it, I upload it, and I just put in there what it was actually for. So it's pretty easy. Go ahead.
Let's say something like sunscreen is a qualified expense today, but 20 years from now, again, that's not a qualified expense anymore.
It's going to go by, because on your receipt, it's got the year. And that would actually be another good IRS kind of question. But typically they don't go back, but, you never know. Other questions? Yes.
Would you have to leave the beneficiary
You don't have to. You don't have to. If you leave it to someone who is under 18, just remember that it's going to go to the, not the estate, it's the, what is the word I'm looking for, Michelle? Who is like the guardian? It would go, the guardian would control it. So just keep that in mind. Great question. Other questions? Nothing? Well, if you do have any personal, come up and see me. But otherwise, thank you so much for coming today. I really appreciate it, and hopefully I gave you some information that maybe you didn't already know.
I have one quick question for all of you. Do you all know how to request a change in your HSA contribution out of your paycheck? You do. Okay. Let me tell you how to do it. Because we're new and we just switched to the Munis system, you would need to log into your Munis ESS account and click on Benefits. The only option for you to make a change at this point in the year is that HSA contribution. So what happens is you will go in there, you make that change, we'll get an email. So that's how we'll find out, and when we get it, we'll apply it in the next following payroll. We have it set maxed out, like there's a limit. The reason being is because there's an IRS limit. It is based on a 52-week cycle because we run on a plan year. So some people might want to make a one-time large contribution, or if you're going to retire and you want to use that mustering out or that final paycheck to put a lot of money in your HSA, you can definitely do that. Log in, put in the maximum that the system will allow you to put in, and then send me an email and say, I really want to do this. And I'll change it for you on the back end to make that happen in payroll. Any questions about that?
I was going to ask you about that.
Where are you going to?
Well, when we were setting it up initially.
Yep.
I could put some-
We can do it on the back end. We want to keep that limit so that people don't accidentally over-contribute, because that has happened in the past. And there's a lot that goes into reversing all of that. So we're trying to prevent that from happening, but we can make it happen for you on the back end. You had a question?
How much yearly does the city contribute to the HSA?
So for most unions and non-affiliated people, it is 75% of the deductible. So for a single plan, you get $1,500 towards your $2,000 deductible, and for a two-person family plan, you get $3,000 towards that $4,000 deductible. As long as you're on the plan for the whole year. If you're new, you get a prorated amount, but if you're on the plan as of 7/1, that's how the contributions work. Anything else? Awesome. Well, thank you all for coming. Have a great day. Happy Halloween.
And also remember, there are a couple of flyers in the back. Feel free to grab them. One is